The highly debated policy was finally signed into law after Senate approved the new legislation that hopes to eventually provide affordable health care to 32 million Americans who are currently uninsured. According to CBSNews.com, the reform will cost $940 billion over the next 10 years. Young adults will be among the first to benefit from the new bill. Gail Walanga discusses how the health reform will affect Miami students.
Students will be able to remain on their parents' coverage until they're 26. That's potentially a huge advantage for a lot of students. Oftentimes, if their parents' plan doesn't allow them to stay on that long, that means they have to find alternative coverage. The university makes alternative plans available. There are individual plans that have been made available. Those are sometimes expensive. Right now we have students who have to pay for their own physicals. They have to pay for their own immunizations because their plan may not allow for that.
Well, I'm excited because, let's face it, I'm not going to be able to afford as good a health insurance as my dad has, so I'm happy with keeping on until 26.
Changes to Medicare will also help the senior demographic, allowing more residents without Medicare to have health insurance and lowering the cost of prescription medication.
There are some smaller changes that will impact all college students and the rest of us in a lot of different ways. Preventive care, that will be covered in health plans going forward.
Although the nation won't see many changes to the current system until 2014, many Americans are already planning for the future.
I think that there is some distinct advantage to saying that we will cover everyone at some level. We know that people go bankrupt because of their health care costs. The conversation that people don't have is, what is enough health care? And that's going to be the challenge.
While the bill continues to be debated, only time will tell how the health care changes will impact the nation.